Great. Okay, well, hello everyone. I'm Mark Clermont. I'm the CEO of Cecelia Health. I'm here to talk about patient confusion. It's a growing epidemic. The majority of people don't fully grasp the information with their during their doctor visits. In fact, 3 out of 4 patients recently surveyed expressed disappointment in the level of Q&A they had with their doctor. 24% of patients leave the appointment without getting clear answers to their questions and aren't sure who to ask. Not surprisingly, patients are awash in health apps, devices, medication delivery plans, messaging from their health plan, their primary care, their pharmacist. It's frustrating, it's confusing, and perhaps this is why 62% of patients are not confident in their understanding of the health information they discuss with their doctor, or why 31% don't even remember it immediately following a visit. For companies across the healthcare spectrum like Cecelia Health, we need to think of this. What if we offered patient support programming with the primary goal of solving for patient confusion? Let's make trusted clinical personnel available in the places where patients are really looking for answers. At Cecelia Health, our moonshot is to serve as a center of excellence for companies across the healthcare spectrum, providing optimal patient support programming for people living with chronic conditions. We're available across the healthcare continuum where patients are actually looking for answers. At the heart of our moonshot team is a national network of clinically trained clinicians who work, specialty trained clinicians who work tirelessly to promote patient education, therapy initiation, medication, and clinical trial adherence. It's scalable. It plugs virtually into existing programs hosted by pharma, device, and other life sciences companies. It also serves as a disease state-specific virtual care provider for health plans and health systems. Think of us as a service-enabled technology company delivering clinical quality to your patients and members. As an example, we recently worked with a patient who lived with type 1 diabetes his entire life. Despite being a Division I athlete in college and being highly attuned to his personal performance, this athlete's glucose levels were erratic and his understanding of how to adjust insulin was limited to guessing. How does a lifelong patient with type 1 diabetes find himself guessing at his life-saving daily therapy? At the other end of the spectrum, we had a 63-year-old patient who thought he was injecting himself with insulin, only to find out after trying for 6 months later that he was not trained on how to use the smart pen that delivered the insulin to him. In that case, his doctor even continued to up his dose over the course of that 6 months, not realizing that the device training was the barrier for effective treatment. I wish I could say those 2 examples were isolated incidents, yet we see them every day. Healthcare companies need to think about closing the gaps that often contribute to therapy drop-off and poor lifestyle decisions and offer something more than inbound support or episodic care. Cecelia Health is the go-to patient support expert who knows how to blend key disciplines of medicine, data, behavioral, and regulatory science to optimize patient experience, adherence, and compliance on pipeline, new or existing treatments and devices. We're demonstrating the power of this model today across health plans and life sciences companies, some of the largest companies in the world. And our results are independently validated by the Validation Institute, Crossix, and others. Our pharma customers report that we are a top performing PDC generator in their partner ecosystems. Our pharmacy customers see 23% increases in medication refill rates and adherence versus control tests. Health plans and providers report excellent clinical outcomes and gaps in care closure. Ultimately, it's the patient and the member who benefits with better health and better appreciation for the companies, the compassionate companies that make this type of patient programming available. For those in the audience today, who are, I'm trying to get my screen stuck here. There we go. For those in the audience who are program owners, talk to us. We look forward to sharing how our disease state-specific centers of excellence can help you, your patients, and trial participants. Let's focus on the real health ecosystem and not just the one that begins and ends at the site of encounter. For investors in the audience, if our story resonates with your portfolio thesis, reach out and we can discuss our capital needs and plan. Thank you for your time.
Thanks, Mark. Great job. Let's go ahead and take some questions. There's a question in the Q&A about your business model. How does Cecelia get paid?
It depends on which the offering company. So health plans typically pay for member support services that include our normal suite of services. On the life sciences side, typically we're plugged into patient commercial and R&D patient support programming. And they'll pay us typically on whether it's a fee for service or an engage for 12-month period.
Thanks for that. And you all have really impressive traction. Can you share a little bit more with the audience about the scale of some of your programs? I'm not sure everybody is familiar with that.
Yeah, I mean, we work with blockbuster drugs. It's 70% of our business is in support of pharma commercial blockbuster drug programming. And what we are handling are any question of a clinical nature. And these are drugs like Saxenda with Novo Nordisk or Entresto, a congestive heart failure medication. It's at that scale. You can look at the plan side of the equation, and we're dealing with and working with patients at an equivalent scale. So we are battle tested here in the US. We're a US only company based in New York City. And as I said, working with a lot of the top 10 companies within their respective industries.
That is awesome. Can you share a little bit about the competitive landscape? Who are your competitors and how are you different?
Yeah, thanks, Katya. You know, we're often people ask us because we happen to work, about 25% of our patient encounters are with patients with diabetes and related comorbidities. So often we get people try to compare us to the Livongos and Omadas, and you could go down the list. And you know what, reality is we work with the full scale of patient population, pediatrics all the way through geriatrics. We're agnostic to insurance types, meaning we work with Medicaid, Medicare, Medicare Advantage, advanced payment models, commercial plans, et cetera. And we're agnostic to drugs and devices. And just in those three main differentiators, and we're willing to work on a white label basis with our customers. Those are four key differentiators from anybody in the marketplace. We don't even consider ourselves competitive with those individuals, those companies, since frankly, at the end of the day, we're selling and serving different patient populations.
Thanks for that, Mark. One quick final question. Given that you have actual folks providing care, where are you licensed to practice? Are there any restrictions there?
Yeah, we're licensed in all 50 states. Our clinical team is a vast array of registered nurses, all specialized in assorted disease states, from diabetes, cardiovascular, pulmonary, renal, et cetera. We also have our license to practice as an endocrinology clinic in all 50 states. And we have a series of requisite PCPs, et cetera, who complement the rest of the team. So we can practice wherever patients need us.